Good morning, everyone. I'm Dr. Brad Marker. I'm the Division Head of Neuropsychology, and I want to spend a few moments of time talking to you about our internship program. Before I do that, I want to say Happy New Year to everyone, and that unfortunately due to COVID, we're unable to host you for an on-site interview. Nonetheless, we look forward to speaking with you on all of your scheduled interview days. So I'm going to spend about 20 minutes talking about our program. When you do have some questions, feel free to ask your interviewers on the day of your interview. They'll all be able to answer whatever questions you have after reviewing this PowerPoint presentation. And so let's go ahead and get started. The Division of Neuropsychology is primarily a diagnostic service. We complete anywhere between 1,800 evaluations to 2,200 evaluations per year. We are a large staff. There are 7 full-time neuropsychologists. 2 of those are attending pediatric neuropsychologists. The other 5 are adult neuropsychologists, and we also have 2 part-time neuropsychologists. We have our 3 interns. 2 of those are adults and 1 is peds. We have 3 fellows. Similarly, 2 of those are adults and 1 is pediatrics. We have 5 psychometrists. We have a practicum students between 2 and 4 per year. We also have a neuropsychometrist coordinator. The health system is a very large health system. We have 5 major hospitals. The main hospital, which is located downtown, has more than 600 beds. We also have a hospital where we see patients out in West Bloomfield, and that has 300 beds. We have numerous satellite facilities. We also have our own community care business and our own health insurance business. So instead of just being a hospital system, we are a health system. We conduct primarily outpatient evaluations in the Division of Neuropsychology, so 90 to 95% of our evaluations are outpatient. We do inpatient evaluations solely on the epilepsy monitoring unit. And so the staff will go over and test the patient at bedside and do the clinical interviews within the hospital. Neuropsychology sees patients at 4 main clinics. Our main clinic is downtown Detroit called One Ford Place. We see patients there 5 days a week of all ages. We also see patients 5 days a week out at the West Bloomfield Hospital in the Division of Neuroscience. We see patients of all ages there. And then our Clinton Township office, also called Seville, we are out there about 3 or 4 days per week, and we see patients across all ages. And then lastly, we have our Dearborn Clinic, where we only see adults and older individuals, and we see patients on that site generally about 1 or 2 days per week. The typical adult patient populations that we see a wide variety of dementias, from your Alzheimer's disease all the way through the Parkinson's plus syndromes. We do pre and post epilepsy surgery evaluations, and those can be outpatient or inpatient. We have a lot of referrals from neurology and neurosurgery for strokes, brain tumors, MS, movement disorders like Parkinson's disease, essential tremor. We do pre and post deep brain stimulation evaluations for both movement disorders and epilepsy. And then we also have a normal pressure hydrocephalus clinic that we're involved in. We have a fair number of psychiatric referrals, and these can range from your straightforward ADHD referral all the way to an individual who might have chronic and severe persistent mental illness and now is experiencing some cognitive changes later in life. We see a great number of traumatic brain injuries, either sports-related or motor vehicle accidents, slip and falls. And then we have probably our greatest referrals would be from the general medicine department, and these are individuals that tend to have multiple medical comorbidities and a complex medical history, and they want us to kind of tease apart what some potential underlying etiologies are to explain their cognitive complaints. On the pediatric patient population side, we have our pervasive developmental disorders. We also operate a CAD clinic, and that runs typically 8 days per month. That's a multidisciplinary clinic staffed by psychiatry, pediatrics, speech therapy, and neuropsychology. The interns have the opportunity to be involved in that clinic. We also do the epilepsy surgery evaluations, have the similar types of neurological referrals. Predominantly, these tend to be more head injury referrals in the neurological population. From a psychiatric standpoint, we see a lot of ADD, learning disabilities, intellectual disabilities, and behavioral problems. We tend to see mild to moderate traumatic brain injuries, and then we have referrals from genetics and cardiology. Henry Ford has a lot of didactics. You'll be involved in typically between 6 to 8 hours of didactics per week. At present, these are all virtual due to COVID. So within our own division, we offer 2 hours of didactics. These run Tuesday mornings from 7:30 to 9:30, and it's a combination of lectures from the neuropsychologists, outside physicians, guests, and trainees. We typically cover forensics, anatomy, ethics. We do fact-finding and various neurological and neuropsychiatric syndromes. You're also required to attend the department grand rounds or the psychiatry grand rounds. Those are Thursday mornings at 8 until 9 a.m. You have your general internship didactics, and that includes medicine for psychologists, case conference, supervision, and other various topics. The general internship didactics typically run Thursday mornings from about 9 till noon. You can, if you have interest, participate in the neuroscience lecture series over at the main hospital. That runs at various times throughout the week. Also, similar to that would be the neurology and neurosurgery grand rounds that occur mostly on Wednesday mornings, but also at other times throughout the week. Brain cuttings right now is on hold pending the resolution of COVID and the hiring of a new neuropathologist. So the adult neuropsychology rotation is a 12-month rotation. Typically, what we have our adult interns complete is 2 to 3 days of in-clinic evaluations, and then in the second 6 months it goes down to 2 days a week and you have a minor rotation. You can do minor rotations anywhere we have a psychologist on staff. So for instance, in the emergency room, in the transplant service, cardiology, pain management, bariatrics, oncology, and typically what the work week will look like, you'll have Monday and Tuesday evaluations. Those will be either inpatient or outpatients, and then later in the week you'll have an opportunity to participate in psychotherapy for a half day a week or cognitive remediation. The expectation is that all of our trainees will complete 4 hours per week of psychotherapy or cognitive remediation. Okay, the rotations will occur with each of the senior staff. Starting this year, we went to a rotation model. So right now, our interns are doing 3 months with a senior staff and then switching to another senior staff over the course of the first 6 months. And then in the last 6 months, you'll do 3 2-month rotations with the remaining senior staff. Pediatric rotation, because we only have 2 pediatric neuropsychologists, you do again, major rotation in neuropsychology throughout the 12 months. You'll spend 6 months with Dr. Phillips and 6 months with Dr. Gindelsberger. You can also do a minor rotation in our CAD clinic. And again, we also have other opportunities for you to do minor rotations similar to those in the adult minor rotation slide. So typically the neuropsychology rotation consists of a comprehensive neurological and neuropsychological evaluation. So right now we're doing clinical interviews mostly virtually, but we do require that our trainees do 1 in-person interview per week. You'll do your own testing and scoring. You'll do interpretation under supervision, report writing, and feedback. You will have weekly supervision, and that is really dependent on the supervisor, whether they want to have a formal meeting time or they want you to just let them know when you're available and schedule kind of on the fly supervision. You'll also do virtual feedbacks with all the patients that you see, and then again the 4 hours of psychotherapy or cognitive remediation. I already talked about the Center for Autism and Developmental Disabilities clinic, where the pediatric interns will have the opportunity to participate several times throughout the year. The neuropsychology intern will be provided with their own office and some testing materials. You'll have a computer, internet access, various office programs. If you're interested, you can dictate your reports through our medical record. We currently use Epic. You'll have access to our online library and search engines. You're also responsible for interviewing, testing, and scoring and report writing of your own patients. Typically, we want the first draft provided to the senior staff in about 2 weeks and the report finalized in 3 weeks. We try to speed that up when we have a post-surgical evaluation, whether that's for epilepsy or for deep brain stimulation. And in those cases, we want a turnaround time in about a week, only because the deep brain stimulation board meets every 2 weeks and the epilepsy board meets every week. And at that time, they want to discuss those cases and determine surgical candidacy. Testing orientation and materials that we use, we have pretty much the majority of neuropsychological tests that one might consider giving to a patient. We mostly use a fixed, flexible battery approach. So we have what are called chart activity sheets, and they have a list of potential tests that we might give to a patient. You and the senior staff will go through that list and determine which tests you want to administer to the patient based on what you know at the time of test selection. We do share some test materials. We are doing a lot of testing right now using iPads as well as through PowerPoint presentations and the use of 2 monitors. And then we have our own standard paper and pencil testing when needed. In terms of COVID safety, we are doing in-person testing. The staff are currently receiving vaccines. I just received my vaccine on Wednesday the 30th for the first vaccine and have my second vaccine dose in 3 weeks. Hopefully by the time that all of the incoming interns starts, everyone will be vaccinated and will be a lot more confident that we're safe in the current environment. Right now we're using face masks, face shields or goggles, and plexiglass shields to separate from patients. Many tests are done on the computers and iPads. We do thorough cleaning of all of our test stimuli and materials and the rooms after the patient has been finished the testing. We do screenings when we do our patient confirmation calls 2 days before. We also do at-the-door screenings to make sure that the patients are asymptomatic. Patients are required to wear a mask when they're undergoing evaluation. If they're unable to wear a mask, they can wear a face shield and be behind that plexiglass shield. And like I mentioned, rooms and equipment are cleaned between patients and at the end of the day. The testing model that we use, it really depends on the individual's age. So for individuals that are typically under the age of 7 or over the age of 65, we do a half-day model. So anywhere between 2 to 3 hours worth of testing plus a clinical interview. For your typical adults and adolescents, so between the ages of 13 and 64, we'll do a full day evaluation. Here they're going to get between 3 and 5 hours of face-to-face testing. If the interview hasn't been done virtually already, then we'll do the interview in person, and that can take anywhere between 45 to 90 minutes. Once the evaluation has been completed, then we'll schedule a feedback, and that feedback is typically scheduled 3 weeks out. It's done virtually and typically takes about 30 minutes to complete. The epilepsy pre-surgical evaluations tend to be 2/3 of a day evaluation. Typical start time are about 8:30 a.m. and generally you're able to finish by about 3 o'clock a.m. or p.m. I'm sorry. So in order to successfully complete internship, you have to present twice in the neuropsychology didactics. Typically you're going to present on a topic of your choice, and then on a research topic, most people present on their dissertation, and then you have to present a case and be involved in our case discussions. And at the end of the year, you're going to complete a year-end major rotation examination. Here you're going to submit a case that's already been completed. We're going to give you some questions to answer about that case, and then we're going to sit down and spend about an hour and a half with you asking you anything under the sun about that case. And this is really to mirror the board certification process or the ABAP process. Our program does an excellent job in preparing individuals for board certification. So not only does this end of year examination focus on the writing sample component of the examination, but during our in-house didactics on those Tuesday mornings, we do a lot of fact finding to help prepare you for that component of the examination. And so that End of year examination is with 2 senior staff and typically takes between an hour and a half to 2 hours. The next slide is a list of where our interns have gone on for neuropsychology fellowships, and then this current slide is some feedback from our prior interns. I'll let you review this at your leisure. These are all included in that PowerPoint and presentation that I attached to the email. And then the last slide, probably one of the more important slides, is the salary and benefits. So currently the salary is $29,120. You get 4 weeks of vacational and personal time. You also get 2 wellness days to address, preventive care. The health benefits that you'll receive include health insurance, vision, dental. You can also purchase life insurance and various other types of insurance at your discretion. If you're interested, there are tax savings accounts, so flexible spending accounts for dependent care, health care. We get 6 paid holidays. These are the major holidays. So Thanksgiving, Christmas, New Year's, Labor Day, Memorial Day, and Independence Day. And then we also cover your malpractice insurance. So at this point, that's the end of my slide presentation. I'm going to wrap up the discussion right now, and if you have any questions, like I said, feel free to ask the senior staff when you're interviewing with them, and if they don't have the answer, please feel free to reach out to me by email or phone, and I'll get back with you quickly with the answer.